Hi, I'm Dr. Colleen Carney, and I am a professor at Toronto Metropolitan University. And for 25 years, I've helped people, especially with insomnia, sleep better. And one of the ways that I do this is to get them to focus on their efficiency of sleep. So let's spend a few minutes talking about that. Do you believe that you're supposed to fall asleep right away, like that, and never wake up until the morning, right when your alarm goes off? This is actually a common misconception. Wake is actually part of our sleep and it's part of healthy sleep. It takes us up to 30 minutes to fall asleep, and that's normal. We can be awake during the night, all told, for up to 30 minutes, and it's normal sleep. So, this is really important to factor into it. Now, one of the ways that we look to see if sleep is healthy and efficient is to look at your sleep efficiency. This is the proportion of time that you are asleep while you're in bed. And what we are aiming for is to be asleep about 85 to 90% of the time that you're in bed, right? If you're in bed and asleep for much more than that, above 90% on average, it means that you may be a little bit sleepy during the day. It means that your body can probably produce a little bit more sleep than it's producing. So if you were to increase your time in bed and see if you felt better and that brings that sleep efficiency down more into the normal range, then that would give you all the answers you need. So people who are not spending enough time in bed, this is one possibility. You can also have too high sleep efficiency if you have a sleep disorder, something like sleep apnea that fragments your sleep. So if you have this high sleep efficiency and you're feeling sleepy during the day, then it might be time to talk to your doctor. If your sleep efficiency is below 85% on average, then this actually means that you probably have insomnia. It means that you're not able to fill up the time that you're in bed. Now, if you are having trouble falling asleep or staying asleep on at least half the nights of the week, and you're having some daytime problems as well, and this has been going on for uh, more than a month, then it might be time to get some help for this. The frontline treatment for this is called cognitive behavior therapy. And it, among other things, will probably ask you to decrease your time in bed to improve the efficiency of your sleep, which sounds counterintuitive. But this will actually lead to a more efficient sleep and a healthier sleep and get rid of the insomnia. Um, so, my closing note here is that rather than aiming for more sleep, discover what is your most efficient sleep, what amount of time in bed you should be spending. And don't set your expectations to be never awake when you get into bed, because that's an unrealistic expectation that will actually lead to anxiety. By focusing on the optimal amount of time in bed for you, you're going to get the sleep of your dreams.